I'm going to offer a framework that may change the way you see hypersensitive clients. Now, mast cell activation syndrome, MCAS, and dysautonomia, which I trust many of you are familiar with, certainly if you're working with clients or you or a family member may be dealing with this personally. These are not separate pathologies, they're concomitant pathologies occurring at the same time. They're not two diagnoses sitting in different departments. They're two expressions of a singular stressed system that has lost resilience. And they present together far more often than they present alone because they're really sharing the same upstream driver. They're just expressing differently. Now, both MCAS and dysautonomia, which you can also call POTS physiology, are downstream from immune load, endotoxin pressure, mast cell priming, vagal nerve collapse, and mitochondrial underperformance. Okay, that's not an exhaustive list, but these are downstream from immense pressure relative to capacity. So the system loses its buffer capacity and then it tips into immune reactivity on one branch and autonomic instability, POTS physiology, on the other branch. Most often, both. And at the same time, they're feeding each other in a cyclical loop. This does not look the same for everyone, but it's important that we understand that it can look like this with different variants. So this is a clinical framework that I want you to carry into today throughout all of this learning, throughout the case study, that it's one singular system that has stopped compensating and it's expressing overwhelm through two parallel branches. So when mast cells are chronically primed, again, from various sources, but such as lipopolysaccharides, mycotoxins, viral fragments, whether that be EBV or COVID, estrogen fluctuations, glycemic instability, chronic stress, they release a cascade of mediators. Not only histamine, which we hear about a lot, but also prostaglandins, TNF alpha, tryptase, leukotrienes, and these mediators enter circulation, our bloodstream. And then when they do this, two things happen simultaneously, but it expresses differently in the individual. On the MCAS branch, histamine and these mediators amplify immune reactivity. So the threshold collapses immunologically, and things that were previously tolerated become intolerable. Foods, supplements, environment, smells. This is a client that's reacting to everything suddenly. This is MCAS physiology. And on the POTS branch, the dysautonomia branch, these exact same mediators, histamine and prostaglandins in particular, act directly on vascular tone. So they dilate your blood vessels, they increase endothelial permeability. So there's seepage within your endothelial tissue, and they disrupt baroreceptor signaling. So blood often pools in your extremities, in your ankles, in your feet. Sometimes this is visible, sometimes this is felt as pain. And with blood pooling in the periphery, when the client stands, your heart will race to compensate to have proper vascular distribution. And then adrenaline, a stress hormone, spikes to maintain cerebral perfusion, to get blood to the brain. And the nervous system locks into what's called a adrenergic overdrive, okay? This is POTS physiology, but this is typically tachycardia, dizziness upon standing, and panic because there's not cerebral perfusion, blood going to the brain. It's pooling in the extremities. So the body is doing everything that it can to have proper vascular distribution, yes? So this is not coincidence that this is occurring simultaneously. It can look differently. People can present with more POTS physiology or more MCAS physiology, but it's typically, when I say one upstream driver, I mean the whole tension that I'm speaking about from various noxious sources, producing two parallel downstream expressions. And there's a loop that I think is very important for us to understand that makes it self-sustaining. So MCAS primes your mast cells, an aspect of your immune system that are vigilant. They're there to respond and to detect stress. And then these mediators that get released with degranulation reduce your vascular tone. When I say reduce your vascular tone, we need a certain tenacity in our vascular system to have a proper blood pressure. Yes, if we have hypotension, maybe individuals here know what low blood pressure is. You feel flaccid, you feel loose. So we need a certain tenacity in our vascular tone, and these mediators cause vasodilation. blood pools in your feet and your legs, which is why some of these individuals feel great with compression garments. But then your nervous system responds because that's not safe for the heart, that's not safe for the brain. We need vascularization, cerebral perfusion. So adrenaline spikes, and then this individual is stuck in chronic sympathetic dominance. The vagal tone drops. So we'll get to the vagal nerve relative to all of this because when vagal tone drops, which is evident on an Oura ring with low HRV, many individuals are using that now. Say your HRV is down at 15, 18, 20. Your vagal nerve can no longer inhibit mast cells. Your vagal nerve is a brake for mast cell degranulation, and then mast cells become more reactive and the loop tightens. So I'm going to suggest that we can't really break this loop by chasing symptoms on either branch in isolation. There's absolutely short-term modifications that are necessary to provide comfort and symptom amelioration. But it's important to work upstream and to identify what has caused this lack of resilience at a system level. So, what does lost resilience actually look like in individuals? Because I think many of us here know that they're presenting very differently. But essentially, a resilient system has lost its buffers, okay? As I said, the vagal nerve. The vagus nerve is a buffer. It inhibits mast cell degranulation. It modulates gut motility. So think chronic constipation. It regulates heart rate variability. Think tachycardia at night. Estrogen at optimal levels is also a buffer. It stabilizes mast cells, it protects gut barrier integrity, it supports bile flow. We'll get to estrogen fluctuations in perimenopause and how they overlap with histamine MCAS symptoms. Short-chain fatty acids are a buffer. They fuel enterocytes, your gut cells, yes? They protect tight junctions. We've talked about leaky gut for so long in the health space, and it is more important now, I think, than ever, and certainly important relative to MCAS. But short-chain fatty acids protect tight junctions and reduce immune translocation, meaning LPS translocation. Thyroid function, optimal thyroid health that you'll learn about in this course is a buffer. It supports mitochondrial output, metabolic rate, cellular energy variability, amongst many things. And glutathione, which we'll come back to regularly and certainly in the context of functional blood chemistry, it is a buffer. It neutralizes mycotoxin load, protects your mitochondria, enables phase 2 detox. It is an antioxidant to mitigate oxidation. My point is that when the load exceeds the buffer, for example, when LPS pour through a permeable gut, when mycotoxins layer on top of that, which is often the case, when hormones fluctuate, I don't want to say drop out, but when they fluctuate drastically at midlife, when a viral exposure hits an already saturated system. Okay, it was COVID, it was EBV reactivation, it was cytomegalovirus. These buffers fail, yes? And suddenly the same inputs, the same diet, the same supplements, the same environment that the system previously handled without symptoms becomes intolerable. And this is often why people say, I was fine, and then 6 months ago, everything changed. And this is not a mystery. This is a threshold event. It's a question of threshold that the load crossed the line and the buffers ran out. Now, in these circumstances, the work is not necessarily to treat the symptoms that they arrive with, although I always say we want short-term amelioration. So we're working short-term with the deeper root causes in mind, but the work is certainly to rebuild the buffers in a system and to identify if you can rebuild the buffers, yes, but in the right sequence and at the right pace.